Hello again mga ka-nursing, welcome back sa ating channel. I hope that you're doing good right now and you're staying positive with life but stay negative with COVID-19. Again, I am Sir Jo, okay, discussing now your community health nursing concepts and other nursing topics that might be helpful not only to registered nurses but especially to those who are studying nursing and who are interested in nursing. For today's topic, we are going to discuss yung tinatawag na primary healthcare. Okay, so what is this primary healthcare? So primary healthcare, so we keep on hearing this primary healthcare not only with our community subjects but also in the news. Okay, so whenever it is related to health, okay, and health programs, we commonly hear the word primary healthcare. So what does this primary healthcare is all about? So what is the meaning of this primary healthcare? So ngayon po, pag-uusapan natin kung paano ba ito nagsimula, kung paano ito na-adapt sa Pilipinas, at sino ang gumawa ng sistemang sinusundan natin ngayon in terms of primary healthcare. Okay, to start with, let us define first what is primary healthcare. Okay, according to World Health Organization, primary healthcare is an essential healthcare made universally accessible to individuals and families in the community by means that is acceptable to them through their full participation at a cost that community can afford at every stage of development. Okay, so when I talk about primary healthcare, guys, these are basically programs, activities that is made to address, okay, essential problems related to health in the community setting. So basically, this is to address public health concern, okay, of the community that focuses now on the problems of each client levels of clientele to include your individual, your families, a group of population, or the community as an entire client. Okay, it says here that these are programs that are made, or essential healthcare that are made accessible. Okay, accessible to the clientele. So, sino yung mga clientele natin? We have four levels of clientele. We have the individual, the family, okay, the population group, and the community. So all the programs or healthcare services that we will be giving to them has to be accessible. So what does we mean? What do we mean by accessible? Okay, accessibility of healthcare. When you talk about accessibility of healthcare, the healthcare should be available within the people's reach. Meaning, dapat, okay, within 30 minutes of travel time, may it be by walk or by travel, by transportation, kailangan naaabot na ng mga tao yung nearest healthcare facility. Okay, and in line with this, that is the reason why nagkaroon tayo ng konsepto ng barangay health station. So barangay health station is basically providing an access for the people of the community through proper healthcare. Okay, to proper healthcare. Kaya nagkakaroon tayo ng mga barangay health stations, okay, in each barangay, especially here in the Philippines. And not only that, it has to be made accessible, okay, this essential healthcare should be made acceptable by the community. Okay, it should be accepted by the community. It should not violate any of their norms, okay, or if in case that it will violate some of their cultural beliefs, we have to present them evidence or scientific data or scientific explanation that will let them understand that this is the proper way to handle health problems. Kasi yun na nagiging hindrance sa ating Philippine healthcare setting, because still a lot of Filipinos are still believing yung tinatawag nating cultural beliefs in terms of handling healthcare. So yung mga traditional beliefs natin, like instead of consulting a doctor, they go for a doctor quack or a doctor taga-baryo or yung mga albularyo, okay, hahampas-hampasin ng mga dahon-dahon, okay, yung mga pasyente nila, okay, well in fact yung palang condition nila is something that's medically or scientifically proven na and can be treated by a biomedic or your tinatawag biomedicine. Okay, but so we have to align, okay, the belief of the community plus the scientific basis of the healthcare programs that we will be implementing and providing for the community, and all these healthcare services should be made affordable. Okay, so it says here in the definition of primary healthcare, it should be affordable. It doesn't said any, okay, in any part of this definition by the World Health Organization that the healthcare should be given for free. Okay, bakit po hindi siya free of charge? Of course, healthcare will cost you something. Okay, that's the point. Healthcare will cost you something. At the same time, the primary goal of public health and community health nursing is for the people to become capable of helping themselves. Okay, because as a government, as a system, okay, if we provide everything for free, tendency people will become dependent to the government na pag may problema sila, may kailangan sila, ang lagi nilang sisisihin is the gobyerno. Okay? Kailangan nila ng trabaho, sisisihin nila gobyerno. Kailangan nila mag-aral, sisisihin nila gobyerno. Okay? Yun ang naging rason kung bakit nagkakaroon tayo ngayon ng dependency. Okay? Dependency of the people to the government. Kasi nga, to be honest, a lot of programs in the government nowadays are considered din naman kasing dole out. Yung tinatawag natin, give lang ng give pero kahit walang ginagawa ang mga tao. Okay, which make the people now dependent. And the primary healthcare wants the people to become independent in terms of their health. Okay, they want the people to understand that no one should be responsible of their own health but themselves. Tayong mga tao, tayong mga individual ang may responsibilidad sa sarili nating health. Okay? So though it is a right of every Filipinos and every human beings to have a good health and of course a longer life, okay, it is not a sole responsibility of our government or the system na i-provide sa atin yun. We have to do something to have that. Like for example, okay, bakit hindi siya free? Kasi nga, there are instances that people, okay, tends to parang sila na mismo ang gumagawa ng sarili nilang sakit. Okay? Then after na magkasakit sila, okay, aasa sila na ang gobyerno magbabayad ng kanilang pagkakasakit. Like for example, alam na natin na ang paninigarilyo ay hindi maganda. It gives you diseases. So common yan, cancer, okay, or lung diseases. Alam na natin yun, nasa pakete pa nga eh. But still we are doing it. And in the end, okay, aasa tayo na ang gobyerno ang sasagot doon sa ating kapabayaan. Okay. So, yun yung ibig sabihin natin. We give the healthcare system an affordable price para hindi naman mahirapan ng mga Pilipino or hindi naman mahirapan ng mga tao to afford it. Okay. But at the same time, we want the Filipino to be, or we want the people to become independent in terms of health. That since I am responsible for my health and pag nagkasakit ako, gagastos ako, kailangan hindi ako magkasakit. So ano yung pwedeng gawin ko? Then he has to do something in order to prevent them or prevent him from getting diseases. Okay, yun primary prevention. Papasok dun yung healthy lifestyle, okay, cessation or removing of risk factors or your primordial prevention kung saan ititigil niya yung mga bagay na pwedeng mag-cause ng sakit. Okay? Kaya nga ang healthcare system natin is affordable at a level. Okay? Sa mga initial levels, binibigay siya free of charge. However, habang patataas po yan, there are certain fees na kailangan na pong bayaran. And of course, this is for the system to continuously grow and continuously function. Okay. So that's the definition. Kaya wag po tayong magrereklamo na bakit wala tayong free na healthcare system. Because in the first place, ang definition nga ng World Health Organization is affordable healthcare system. It doesn't say there that it is free of charge. Yun po ang ibig sabihin nun. Now, when we talk about primary healthcare, this is a program, or this is an approach that was adopted by the Philippines. Okay? So, how does it started in the Philippines? Paano po siya nagsimula? So, the history of primary healthcare in the Philippines is, it was adopted when the Philippines joined the first international conference of primary healthcare. Okay, so this was held in Alma Ata, Russia, way back September 6 to 12, 1978. Okay, and it was attended by 127 countries, including the Philippines. And the following year, okay, it was adopted in the Philippines under the Letter of Instruction 949, signed by the late President Marcos or Ferdinand Marcos, because he was the president at that time. Okay, and based on and this was adopted in the Philippines October 19, 1979, the following year. Okay. So kung yung sistema ng healthcare system na meron tayo ngayon, okay, yung pagkakaroon ng mga healthcare system, mga free vaccinations, okay, yung mga pagtatayo ng mga health center was actually a product of the adaptation of primary healthcare during the time of Marcos. Okay. So I'm not totally saying that I'm totally agree with what happened during the martial law or what, but this is actually a positive thing na nangyari during that time because this was actually adopted, okay, during his reign as the President of the Philippines. Kaya, and nag-evolve na lang po na nag-evolve itong primary healthcare na ito. So, when this was established, when this was created, it has a vision and a mission, okay? The vision, when it was adopted in the Philippines, adapted from the original vision, okay? Nung inadapt siya sa Pilipinas, ang naging vision ng primary healthcare is that health is a right, okay, of every Filipino and Filipinos, all Filipinos, okay, all Filipinos has the right to have a good health. And the vision of the Philippines in terms of the primary healthcare or the vision of the DOH way back then is the health for all Filipinos by the year 2000 and health in the hands of the people by the year 2020. Ibig sabihin po, kung makikita nyo sa ating vision, okay, the health will bring or the government will bring the health to all Filipinos by the year 2000 and by year 2020, which is last year dapat, ang Pilipino daw is already independent in terms of health. Na yung mga Pilipino daw will able to maintain their health at their own level. Okay? Dapat meron na tayong healthy lifestyle living. Okay? Dapat daw umiiwas na tayo sa mga bisyo. Okay, yan pong ibig sabihin ng vision na ito, na ang mga Pilipino is independent na in terms of taking care of themselves, in terms of their health. Okay, then how? Okay, paano yung gusto ng primary healthcare? So this refers now to the mission. Okay, the mission of primary healthcare in the Philippines. And the mission is that to strengthen the healthcare system wherein people will manage their own healthcare. So kung i-relate natin yung vision kanina, okay, at saka yung mission, nakalagay na naman dyan. It uses a different phrase, hands in the hands of the Filipino people. People will manage their own healthcare are same. It says the same thing. Okay, parehas mong sinasabi na dapat ang mga Pilipino, okay, or ang gobyerno, i-strengthen niya yung ating healthcare system. Ibig sabihin, we will bring it to the people. Okay, so health in the hands of the Filipino people. Then after that, people will able to manage their own health, okay, or manage their own health care. Yun po ang ibig sabihin nun. So let's put it into scenario. Pag sinabi nating primary goal kasi ng community health nursing is enhancing the capability of the people. When you say enhancing the capability of the people, it means to say that we want them to become independent. In other words, we want them to become self-reliant. Okay? Kailangan meron sila ng konsepto ng autonomy na kami, sarili namin to, kami yung may desisyon, kami dapat ang gumawa or mas responsibilidad sa aming sarili. Yun po ang point ng ating primary healthcare. Okay? Ang ating community health nursing and public health nursing in relation sa gusto ng primary healthcare na at the end of this program, at the end of the programs under the primary healthcare is yung mga Pilipino is magkaroon na ng sense of responsibility about their health. So kung titignan natin sa konsepto, okay, pagdating natin sa community, the approach should be we will act as facilitator. We will help the people to identify yung mga health concerns nila. We will not dictate, we will not tell them what the problem is. Okay, it should be them who will identify the problem. It should be them who will identify the solution to their problem, and it has to be them who will act, okay, based on the identified problem. So what is our function? Our function is to provide assistance. Our function as nurses in the future, as nurses, okay, who are working in the community, is to provide assistance for them to realize the presence of the problem. Hindi mo i-dictate na kahit nakikita mo na ang isang problema, maduming kapaligiran, pero hindi nila nakikita yung essence na may kinalaman yung pagkakaroon ng maduming kapaligiran sa pagkakaroon ng sakit. Okay? You will not tell them na, oh, linisin nyo yan kasi pwedeng pagmulan yan ng lamok. Okay? So what will you do? You make them realize how you provide health education. That is our primary responsibility. You explain to them the possible things na pwedeng mangyari. And at the end, yun pala ang problema. So ano yung kailangan naming gawin? O ano yung kailangan kong gawin? They should realize that on their own because we want them to become independent and we want them to realize, okay, that they are responsible for their own health. Okay, so that is basically the concepts of your primary healthcare in the Philippines and how it was started in the Philippines. Okay, now here are the basic concepts about your primary healthcare. So the basic concepts includes that primary healthcare is characterized by partnership and empowerment of the people that shall permeate as the core strategy in the effective provision of essential health services that are community-based, accessible, acceptable, and sustainable at a cost which the community and the government can afford. Which means to say that primary healthcare is a partnership between the government and the community people. Basically, we want the community people to become empowered, which is in line with the vision and mission of primary healthcare, that Filipino will be the one responsible with regards to their own health. And the primary goal of public health and community health nursing, which is enhancing the capability of the people, or um, for the people to become self-reliant or independent in terms of their healthcare. And when I talk about primary healthcare, these are programs or essential healthcare that are community-based, that are accessible, acceptable, and sustainable at an affordable cost, okay, which the community and the government can afford. So it says they are sustainable, and we cannot sustain a certain program without funding. Okay, and the funding will come now from the taxes and from the okay the minimum cost of healthcare services that we are getting from the healthcare system itself. Okay, and when we say funding, okay, of the healthcare system from the tax, okay, that we are paying, so we are actually paying the free healthcare services that we are receiving at the lowest level of healthcare facility, okay, indirectly through our tax. That is why it is not free. Okay, so the services are not free because these are services already paid through our taxes. Okay, so that is what we mean by primary healthcare concepts. Now, there are several elements or components of primary healthcare that we need to know. And in order for us to understand this, I have made use of the mnemonics elements, okay, elements home. So this mnemonics is actually a mnemonics that was passed down to me or to his student, okay, by my former instructor and um should I say mentor in terms of community health nursing discussion. Okay, so elements stands for the following. Elements home stands for the following. E means education for health. So education for health, because as part of the levels of prevention, please do look for the video. We have a link, okay, sa ating description section later on about the primary the levels of prevention. Okay, under the primary levels of prevention, health education is the most important. Okay, and the best strategy that we can use to promote primary prevention. Because according to a lot of studies, okay, the number one problem in the community or in the healthcare system is the lack of information. And in order to address that, is that the primary responsibility of the nurse is to provide education to these people, okay, or to the community, so that the community will be able to aware of the information available or the programs available for the different age groups and for different health conditions. Okay, actually yun yung nagiging problema sa Pilipinas. Marami po sa atin ang hindi aware na ang isang particular na programa is actually existing. I'll give you a very good example why the lack of information is the most common problem in the healthcare system. Okay, as of the moment, included in the top 10 cause of mortality in the Philippines is your tuberculosis, your pulmonary tuberculosis. Okay, this is um, the fact that pulmonary tuberculosis is already a curable communicable disease. Okay, nakakahawa siya. It is a highly transmissible. However, it is already curable. And at the same time, we already have an available vaccines, okay, to prevent us from getting tuberculosis. And on top of that, okay, kung ikaw ay nagkaroon na ng tuberculosis, treatment are actually given free of charge, okay, at the primary healthcare level of facility. Kung meron ka ng 2 weeks or more than 2 weeks of cough, okay, at medyo bumaba ang timbang mo, nilalagnat ka tuwing hapon o yung tinatawag low grade fever, Okay, you can actually go to the health center, and yung health center, pag na-assess ka nila, they will make you, they're going to write a prescription, pupunta ka doon sa, um, doon sa laboratory ng rural health unit, then you will undergo either sputum test or your culture and sensitivity test, and your x-ray. Okay, kung meron ka ng 2 weeks ng ubo. Okay, then i-check nila yun free of charge. And if in case, wag naman po sana, mag-positive ka for tuberculosis, medications will also be given free of charge doon sa health center. All you have to do is to go to the health center and ask for it. Okay, those are the things, okay, kung bakit talaga ang health education, okay, is actually yung pinaka primary na ginagawa ng mga nurses in the community, because this will address the primary problem, which is the lack of information. So that is for education for health. Another one is the locally endemic and communicable disease control and treatment. Okay, as of the moment, marami pa rin po tayong mga endemic disease in the Philippines, like for example, your malaria in Palawan, okay, schistosomiasis in somewhere in Samar or Visayan region, in Mindanao region, okay, marami pa po. Okay, and these are part of the primary healthcare program. So that is why na-develop yung tinatawag nating API, or the Expanded Program on Immunization, which was established through the legal basis noong Presidential Decree 996, and it was already updated na ngayon with the National Immunization Program of the government. Okay, with a new law. Okay, I forget the exact number, but it's a Republic 11-15-23 if I'm not mistaken. Okay, so please comment down sa section kung mali po si sir. But I think it's 11-15-23. Okay, so locally endemic communicable diseases. Kaya tayo nagkaroon ng mga free immunizations. Okay, immunizations for hepatitis B, diphtheria, pertussis, tuberculosis, tetanus, ano pa ba? Chickenpox, mumps, German measles, and a lot more. Okay, so nagkaroon tayo ng mga doon. And of course, it's treatment. Okay, yung mga basic treatment po ng mga to, ng mga communicable disease na to, some of the medications or essential medications are already part of the supplies and logistics of the local health unit o yung mga primary healthcare facility natin under the government or under the local government based on devolution code. Okay, another one is your letter E, expanded program on immunization. I have already mentioned about this, okay, in relation to the communicable diseases. So we have your EPI, which is now known as your National Immunization Program. Okay, so this basically provides a mandatory immunization to all infants. Okay, sa ating batas ngayon, less than 5 years old, kailangan mabakunahan sila under the National Immunization Program. It's free of charge at the primary level. Okay, at the primary levels, mga health center natin, barangay health stations, your rural health unit. So free of charge po yan. The logistics is coming from the national government, passed down to the regional offices, to the provincial, then to district, and to your municipality, down to your barangay health stations. Okay, next is maternal and child health plus your family planning program. So maternal and child health plus your family planning program, this is one of the we'll try to address as well. This your maternal and child health program are programs that are in line to address yung developmental goal number 4 and 5, which is reducing infant mortality rate and improve maternal health program. Noong Millennium Developmental Goal pa lang ang focus ng ating primary healthcare system. Ngayon po kasi meron na tayong tinatawag na Sustainable Developmental Goal. So when this was created, primary healthcare focuses on addressing also yung number 4 and 5 of the Millennium Developmental Goals. So yung my kid, okay, yung bunso ko first nandito, nakikialam. But anyway, never mind her, okay. Andito lang siya sa tabi-tabi ko. Another one is your essential drugs. Okay, essential drugs. This is what I'm trying to say earlier. Okay, some of the communicable diseases and other non-communicable diseases, essential medications are already available at the lowest healthcare facility, your rural health unit, barangay health stations. Okay, may mga free medications po na binibigay ang ang DOH. Okay, sa mga problema po ng gamot for high blood. Okay, basta may stock po, available yan sa mga health center natin. Binibigay po yan free of charge. Like for example, your losartan, amlodipine, okay, mga essential drugs. Even even your insulin, okay, insulin 70/30, okay, is also available in the health center. Okay, actually my mom or my mother who is diabetic is part of this program. So nakakakuha po kami ng libreng gamot sa health center. Thank you for that. Pero ngayon po ata is due to the pandemic, nagkulang na sa funds kaya hindi pa na-sustain. But hopefully it will go back soon para naman po mas mapakinabangan pa ng lahat. Okay, essential drugs. And of course, the drugs for tuberculosis, drugs for pregnant women like your ferrous sulfate and iron supplementation, your metronidazole, mga albendazole, okay, mga pampurga, vitamin A, lahat po yan ay essential drugs available in the local health unit. Okay, another one is nutrition. Okay, there are a lot of nutrition programs that we are doing in the community. So nutrition programs, mga pagbibigay natin ng mga vitamins din, supplementation, and vitamins and mineral supplementations plus feeding program not only in the health center, in the barangay level as well, and also in the school. So nagkakaroon sila ng feeding programs din. Okay, next is your treatment of medical and emergency care. Okay, of course, these are part din sa mga local healthcare facilities, sa ating mga emergency hospitals. Okay, sa ating mga public healthcare facilities, district hospitals, and primary hospitals. This is given, most of it are actually free of charge for as long as you are an indigent. Okay? And we also have your sanitation of the environment. Part din po yan. Kaya tayo nagkakaroon ng from time to time cleaning programs because we have to accept the fact that there is a direct relationship between a client's health or the community health and their environment. So pag madumi ang kapaligiran natin, mas prone tayo na magkaroon ng mas maraming sakit. Okay, like communicable diseases, yung mga tinatawag natin diarrhea. Okay, common po 'yan sa mga areas who have an environment na medyo hindi siya sanitized or unsanitized. Okay, na medyo dumadumi. Okay? At the same time, included po sa elements yung elements home, yung tinatawag nating hospital and wellness center. Nagkakaroon na po tayo. Of course, yung hospital po is depende po 'yan po kasi kung part po siya ng national or local government budget. So, naging epekto po yun ng devolution code because according to devolution code, kung nangangailangan ng hospital ang isang local municipality is, dapat pondohan nila yon unless that is something that they can't do and they need to request help from the national government. That's the time na makikialam ang national government to put up a hospital. Okay, hindi lang po siya basta-basta. Yun po yung sinasabing devolution code. Okay, devolution code. And the oral and dental health, part din po yan, kahit po sa mga buntis. Kaya po nagka-calcium supplementation na rin po sila kapag sila ay buntis. Okay, monitoring your mental health, especially during this pandemic. Tumataas po ang ating mga mental health cases. Okay, marami na pong teenagers are committing suicides, which is sad to say. Okay, kasi meron po tayong programa dun sa local health system na tinatawag na community mental health nursing. Community mental health nursing is basically yung approach ng ating gobyerno kung saan at the primary level, kung ikaw sa tingin mo hindi na healthy ang iyong mind, okay, na naguguluhan ka na, so physically okay ka pero yung mind mo sa tingin mo hindi, you can go to your nearest health center and seek consultation. Okay, if that is something that they cannot handle, okay, they will refer you naman po sa mga higher referral system like secondary or tertiary hospitals that specializes on psychiatric care. Okay, yun po yung problema sa Pilipinas kasi when we talk about mental health, unang pumapasok sa isip ng mga Pilipino ay baliw. Hindi po. Hindi po lahat ng nagpapakonsulta sa psychiatric doctors or psychiatrists ay baliw. Okay? May mga pagkakataon po na kahit tayo na mga regular na tao ay pwede ding magpakonsulta pag tayo ay anxious, nababagabag, maraming inisip na problema at sa tingin natin na apektuhan na yung ating trabaho, we can also seek consultation. Okay, wag po tayong mahihiya kasi party po yun ng ating buhay. And of course, the last one is elder clients. So elder clients, okay, marami tayong programa para sa kanila. Senior citizen programs. Okay, actually marami tayong programs that are directed to senior citizens. Yung pagbibigay ng mga gamot, part of the non-communicable disease program of the Department of Health. We are providing essential medications to them, and of course other activities such as exercise, yung mga Zumba. Okay, kanya-kanyang style po ang mga health center natin, and they are part of the target na gusto nating masolusyonan. Okay, kasi yung population natin is already growing and marami na po tayong elderly client. Okay, so those are the components of your primary health care.